meet the humerus. As with all of the bones in the body, there are multiple landmarks that are important, and the ones that you need to know include the head of the humerus. This is what will articulate with the glenoid fossa of the scapula, forming the glenohumeral joint. The greater tubercle and the lesser tubercle. There will also be the intertubercular sulcus, which is more easily remembered as the bicipital groove. The tendon of the biceps muscle will reside in that. The deltoid tuberosity is the landmark to which the attachment of the deltoid muscle sits. And at the distal end, there's a lot of activity in terms of landmarks, which we'll talk about in a second. Just as an aside, you will see in the diagram on the left, there is the anatomical neck and the surgical neck. You can probably figure out why the surgical neck is named the surgical neck. Yes, because that is where it would be repaired surgically if there's damage. If you are still looking at the left diagram or the image on the left, you can see at the distal end there is what's known as the trochlea. That will articulate with the trochlear notch of the ulna and give you the ability to flex and extend your antebrachial region at the elbow. That allows you to flex and extend your arm at the elbow. Taking a look at the diagram on the right, you will see the olecranon fossa. That's going to articulate with the olecranon, which is sort of the most proximal part of the U of the ulna. We'll see that a little bit more closely, a few images from here. The two bones that form the antebrachial region will be the ulna and the radius. The ulna conveniently has that U shape at the proximal end, and the radius has a disc-like head, so they are extremely easy to differentiate. This shows you up close and personal what's going on in the elbow region, both posteriorly and anteriorly. The capitulum, which is at the distal end of the humerus, will articulate with the radius, and the trochlea will articulate with the trochlear notch of the ulna. Let's take a look at the ulna. If you take a look at the photograph on the left, you can see the olecranon, which again is the most proximal part of that U of the ulna. The more distal part of that U is the coronoid process, and the notch in the middle is known as the trochlear notch, which is labeled on the diagram on the far right. There will be a membrane, which is known as an interosseous membrane, between the ulna and the radius, which acts to stabilize the two bones. There will be two joints in between the radius and the ulna. One will be proximal, hence the name proximal radioulnar joint, and the other will be distal, hence the name distal radioulnar joint. At the distal end, the radius and ulna will articulate with the carpals. This shows you a lovely view on the left of the olecranon, the trochlear notch, and the coronoid process. It also shows you the radial notch, which is where the head of the radius will articulate with the ulna. The diagram on the left shows you the distal ends of the radius and ulna at the carpals, and those are more for your information, just so you have some visuals. With regards to the carpals, the metacarpals, and the phalanges of the hand, we know them as fingers. This is what you need to know. I will not ask you specifically to name the carpals, you need to know them as a group. It is kind of fun, though, to know that the trapezium is going to articulate with the first metacarpal, which helps form the thumb. It's associated with the thumb. They rhyme. When you are naming the metacarpals, they are named via Roman numerals. The first metacarpal will be the thumb, and then the pinky finger will be metacarpal number 5. Please remember that the phalanges have 3 segments: proximal, middle, and distal regions.